You are dispatched to the soccer field at Algonquin College for a 19-year-old male experiencing shortness of breath.
Okay, so my first step is to look for any kind of hazards. So we're on a soccer field, so there could be an evenness of terrain. There is some people around. I don't think the people will be rowdy, so I don't think we need any kind of police or fire. I don't think we need any of them right now. And then Fry, there was no indication of Fry for dispatch, and there is one patient. And I'm gonna approach with ABC because the patient was awake.
Okay.
And then I would start with my patient assessment triangle. So I would ask what their tone is like.
They are lying down on the team bench.
Team bench, okay. And is they interacting with anyone?
Yes, interacting with the people around them.
Okay, perfect. And then I would assess breathing. So they are breathing?
Yes.
Obviously. And then any kind of abnormal sounds?
You're hearing some wheezing.
Some wheezing, okay. And is there any cyanosis?
Nope.
And what does their pallor look like?
They have a unremarkable skin color.
Okay. And then I would approach the patient, and I would go, "Hi, my name is Kassandra. I'm a paramedic student." Do I get a response?
Hi,
Oh, hi. Can you tell me your name?
my name's Max.
Max. Okay. Can you tell me how old you are, Max?
I'm 19.
19. Okay. Have you been sick within the past 3 days? Nausea, vomiting, diarrhea, anything like that?
Nope.
No. Okay, then I would move on to, I'm still gonna stick with my ABC kind of flow.
Okay.
Did my Fry, and then I'm gonna, did you hit your head, neck, or back or anything?
Nope.
No, and can you tell me what happened?
I was playing soccer and then I started having trouble breathing.
Okay. I'm still gonna keep ABC. I did a little bit out of order, and then I'm going to assess the patient's airway. So I would just ask Max, can you open your mouth for me? And then I would look in. Do I see any blood secretions, swelling, obstructions, anything like that?
Nope.
No. And if I get Max to smile at me, do I see any kind of facial droop or slurred speech?
Nope.
Okay. But he was feeling, so airway, and then I would do breathing. So then breathing would be rate, rhythm, and depth.
Regular rate, regular rhythm, labored.
Labored. He did say that he was having trouble breathing. I'm just gonna set him up.
Okay.
If I can set him up. Here we go. I'm just gonna set you up here. Here we go. So rate, rhythm, depth, and then I would look for symmetry of chest rise and fall. And am I seeing symmetry? Okay.
Yep, symmetrical chest rise.
Am I seeing any accessory muscle use?
No accessory muscle
No
use.
accessory muscle use, and accessory muscle use. Breathing, breathing depth. I can't. I'll get them to look that way and assess for GVD.
No JVD.
No GVD. Okay. Symmetrically. And then I'm gonna move on to circulation.
Okay.
Okay. I'm gonna assess radial pulse because they are awake. And what is the pulse that I'm feeling?
Pulse is regular rate, regular rhythm, and strong.
Regular rhythm, strong. And then what kind of temperature am I feeling as well?
Skin is warm, pink, and dry.
Warm, pink, and dry. And then I would move on to cap refill, and then the cap refill, what would it be if I pinch his finger?
Under 2 seconds.
Under 2 seconds, and then I would go ahead and do palpate the abdomen. So then I would do all 4 quadrants, assessing for tenderness, rigidity, looking as the patient as I do it, tenderness, rigidity, distension, masses, any kind of different color?
No abnormal findings.
Okay, then I would move on to the legs, and then I would pull the patient's pants up if I could, and then I would look at them. Are they symmetrical?
Yes.
And then if I push it, is there any pitting?
Nope.
No. Okay. I forgot to do my auscultation, so I would quickly auscultate on him just from the front. Again, breathe in, and then out, in, out, in and out. And then from apices to bases, to me they're sounding clear bilaterally, but what am I hearing?
As found. Full air movement, wheezes at the bases.
Wheezes at the bases. Okay. So patient, I have a 19-year-old male, Max. There is wheezing at the bases. Nothing in the apices. And then he has regular rate rhythm strength for pulse. Except for the wheezing, there was no other abnormal findings. When we sat him up, he seemed to feel a little bit better. He chest rise